You're never told that life could ever get this way.
Let's face it, chemo isn't pretty. There's nothing lovely about the side effects of chemotherapy. So what kind of side effects can you expect when you're taking chemotherapy for breast cancer? And what are some tips that can help you manage those side effects better? Let's get into it. In this video, we're going to talk about at least 10 tips to help you best manage your chemotherapy side effects. And those side effects include things like nausea, exhaustion, pain, hot flashes, and thrush. Let's get started. One of the things that your general oncologist is most likely going to prescribe for you before chemotherapy starts is Zofran or some other kind of anti-nausea medication. I suggest that you take this medication before you even have any side effects of nausea. If you stay ahead of it, you're more likely to manage it better. Now, I won't lie, I had a little bit of nausea with my adriamycin and Cytoxin, which is also called the Red Devil. Don't let that scare you. We need it to conquer the tumor and shrink it and fight this breast cancer. And no, it's scary, but don't let it scare you, one day at a time. But I am an example of success with that Zofran. I took it ahead of time. I took it on schedule, and never once did I vomit from my chemotherapy. Now, I can't promise that's going to be true for you, but I just wanted to let you know that this is a testimony of how the Zofran being taken on schedule worked for me. And I hope and pray that your nausea is minimal like mine was. But even if it isn't, one of the best pieces of advice that I'll give you throughout all these videos is to take this one day at a time. Tip number 2, eat more but smaller meals frequently throughout the day. Try to make them as healthy as possible, but you definitely need to make sure you're getting food in your body. Now, if you're trying to eat as healthy as possible, especially if you are estrogen and progesterone positive or hormone positive, in my life after breast cancer and reading the book, The Pink Ribbon Diet, which I'll include a link below in the description, I learned to eat 1 protein, 1 fat, and 1 carb at every meal. And I allowed myself to eat as many fruits and vegetables as possible. But I'm going to talk about the eating raw right now. There's a little bit of a risk in that, and I'll explain it in a few minutes. Doing what the Pink Ribbon Diet suggests helped me feel fuller longer, but because this is chemotherapy, you're wanting to eat smaller meals more frequently throughout the day. So whatever you can keep down, try to do that. But my favorite breakfasts that you can do during chemotherapy, because you're not using raw fruit, or you might use raisins, which are cooked, or they're not raw, is to do an oatmeal and put 2 tablespoons of pecans or walnuts or some kind of nut in it for your protein, and then add a fruit in there. You could go ahead and cook it like blackberries or blueberries. If they're cooked with the oatmeal, that would cook it so that there's lower risk of getting an infection from eating raw food right now during chemo. You may find that you have to just find something that agrees with you during your chemotherapy, but I've personally found that when I eat healthier, it helps me manage not only the nausea, but the other side effects as well. Now, if you do find that you are having trouble keeping food down and you end up vomiting, things that are dry like crackers and toast are good. Now, you do have to be careful on what you put on your toast. It needs to be cooked, but if you vomit, you're just trying to get back to being able to keep things down. So crackers and toast are great when you run into that side effect. Stay hydrated. Stay hydrated, stay hydrated, stay hydrated. Did I say to stay hydrated? Yes, I did. Drink, drink, and drink some more. Not alcohol, though. Preferably water. Preferably not things that are caffeinated, although I did talk to my integrative doctors when I was doing chemotherapy, and they said that like 2 cups of green tea are fine, but you absolutely need to stay hydrated. For one, it will help the chemotherapy get where it needs to go, but then it sends it out. It flushes it out so it does its job, and then it leaves so that you have minimal or fewer side effects. Now, some people have trouble drinking water. Other ways that you can get water in your body without having to drink so much of it is to have a lot of soups and other things that have water in them. Now, would I suggest smoothies at this time? No, because smoothies involve raw ingredients. They involve things like dairy and uncooked foods. And that's something you want to stay away from when you're on chemotherapy, because you want to lower the risk of having a foodborne illness that can interrupt your chemotherapy and can also exacerbate nausea and vomiting. Now, I by no means replace a doctor or a dietitian. So if you want to get the best advice, medical advice, then I suggest that you ask your oncology team to connect you with a dietitian and or an integrative doctor, and they can give you more specifics on how to eat the most nutritious meals during chemotherapy. It's very, very important to practice good hygiene when you're on chemotherapy. And I've already talked about this earlier. Make sure that you are eating cooked foods. That's part of your good hygiene. Cooked foods. Make sure you are washing your hands frequently. I don't personally suggest antibacterial soap, but wash your hands as frequently as you need to after you go to the restroom, after you've pet animals or worked with animals, when you are cooking and working with raw meat that you're cooking. So practice good hygiene. Again, if you do happen to end up vomiting, I already talked about eating dry foods earlier. I need to go back to this and say that you need to only eat dry foods when this happens, and then gradually add back other foods. If you're vomiting a lot, you need to make sure that you're letting your care team know so that they can help you manage this. Some people have to go to the hospital and have IVs of fluids to help get their hydration back where it needs to be. Don't be hard on yourself if this becomes your situation. Just know that they're there to help you stay on top of this. They're part of your team, and they're trying to help you move forward with this part of your breast cancer journey. While we're still on this topic of letting your care team know about things, make sure they know if you run a temperature, especially if it's 104, 105 or higher, because they need to bring this down. And again, this may require hospitalization, it may not, but make sure you let them know so that they can help you better stay on track with your chemotherapy journey. Another thing to watch out for and to communicate to your care team is make sure that you are looking in your mouth. If you're starting to feel like you have to clear your throat a lot, it's feeling scratchy, you may have developed thrush. Check by looking with a flashlight and in the mirror. If you have white dots on your the back of your throat and on your tongue, that's typically a sign of thrush. Contact your cancer team with that. If you contact your doctor, they might not necessarily know what's going on. So let your general oncologist know, because they're more likely to better remedy this instead of giving you something like an antibiotic thinking that you developed strep or something like that. Because 9 times out of 10, it's usually thrush, which is a common side effect of chemotherapy, specifically adriamycin cytoxin. It's a yeast infection that's developed orally. And my general oncologist prescribed me nystatin, which is an oral medication to combat oral yeast infection. While we're on the topic of oral health, I know this sounds strange, but you can't usually brush your teeth with toothpaste when you are going through chemotherapy. Some chemotherapies cause your gums to be more sensitive and the lining of your mouth to be more sensitive. So when you're on chemotherapy, it's suggested usually to just have a rinse of water and baking soda. And if you brush your teeth, use only water and baking soda on your toothbrush. You need to take small, frequent walks if you can during your chemotherapy. This helped me get fresh air, which helped me manage my nausea a little bit. It also helps manage your pain better, because the more active you are, the less you have joint pain. Now, don't be hard on yourself that if you can't do as much as you did prior to your chemotherapy. But the point is to try to get up and take periodic breaks where you take small walks. They don't need to be things like you're preparing for the Olympics or anything. Just a small walk where you're getting up so that you're able to help your joints and also get fresh air. It helps a lot. Walking also helps improve your mood, and especially if you were hormone positive, but with any breast cancer patient, any cancer patient for that matter, it helps to keep your mood elevated, because just cancer itself can be hard on our emotions and hard on managing our mood. And when you walk, you're increasing endorphins and serotonin and other things that chemically help improve your mood, naturally chemically help improve your mood. It also helps increase your vitamin D, which helps improve your mood. And enjoying sunsets and sunrises can help improve your mood. So get out there, even if it's just a little tiny walk. Since I recently mentioned vitamin D being naturally consumed when we go out in the sunshine and just get daylight, even if it's raining, I want to talk about supplements briefly. Normally, I would not encourage taking supplements, but during chemotherapy, and even if you have to take hormone blockers after your active treatment is over, sometimes you will find that it is necessary to take supplements, because no matter how healthy you eat, you find yourself deficient on things. When I was in active treatment, specifically chemotherapy, but even now, I take a vitamin D and calcium supplement, because the chemotherapy, when I was on chemotherapy, was making it hard to keep up with that no matter what I did. And I'll talk about managing side effects on hormone blockers at another time, but that is another time that you may have to have some supplements for your body to keep up with certain vitamins and minerals that they're not able to keep up with because of the medications you're on. Consult your doctor about this. Before I move away from talking about supplements, I want to stress that you want to try to go for non-GMO and organic supplements, not just any supplement off the shelf. One more thing to talk about when talking about any medications or vitamins or supplements is to let your care team know about every single one of them. They need to know about every single one of the things that you're taking that is a medication, a vitamin, or a supplement, in case it may interfere with your chemotherapy, with the effectiveness of it, or it might cause contraindications that could cause serious side effects that you want to alleviate or eliminate. Now, I'm going to try to move on from managing your nausea side effects, but another side effect that might overlap or cause nausea is constipation. It is very common to develop constipation when you're on chemotherapy. Remember, I said to stay hydrated? This is one way to manage constipation. Remember when I said to take small but frequent walks? This is another way to help manage constipation. And remember, I said that you may have to have some medications and supplements you wouldn't normally take. And one of them could be a stool softener. Now, I know normally videos don't have over 10 tips, but the reason there are so many tips in this video is because there are so many side effects that you can run into with chemotherapy, and I want to give you as many as possible. Now I'm going to talk about managing exhaustion, managing tiredness, that kind of tiredness that even sleep sometimes doesn't remedy. Chemotherapy can be very exhausting. I'm not gonna lie, which is another reason that I keep stressing and emphasizing trying to eat nutritiously as possible, because when you eat junk food, it increases inflammation, and inflammation gives you stomach aches. It causes all kind of problems, and you want to try to get a good night's sleep, and sometimes that's even impossible, even if you're staying on top of as many tips and tricks as you can. But if you're eating junk food, it's increasing inflammation, which causes a stomach ache, which can cause you to have insomnia at night. With indigestion and stomach aches, you're finding yourself having to get up frequently in the middle of the night, which of course, even when you're not on chemotherapy, can be exhausting. Eating junk food also gives you only short bursts of energy, where eating nutritious food gives you more efficient release of energy, long-term energy. Chemotherapy can wipe out a lot of red blood cells, and red blood cells are responsible for carrying oxygen throughout your body. So one thing that I suggest is in your nutritious diet is to go for a lot of foods with iron in them. You cannot eat raw spinach, but you can incorporate a little bit of spinach in different things. Like put it on pizza. If it's baked, it's cooked. So you lower the risk of foodborne illness with that. Now, greasy foods, oily foods can increase indigestion, but if you're really low on iron, chicken liver and beef liver do help with that. To minimize the risk of side effects and maybe nausea, eat those more for something in the middle of the day instead of at night, so you don't have indigestion issues at night with the greasiness. But also try to cook with things that aren't seed oils. Cook with extra virgin olive oil. Other places that you could incorporate spinach in your cooking is to make a frittata. If you have a frittata, it's going to have egg in it, which increases your protein. But you can incorporate a little bit of spinach, which won't be soggy, which can be hard on your palate when you're managing nausea. Just a little bit, like a quarter cup or less of spinach in a frittata or an omelet can help. Because again, spinach has iron. The same thing with putting a little tiny bit in something like pasta. Pain is another side effect that you most likely are going to deal with while you're doing chemotherapy. I already mentioned taking short walks helps. Staying active, not like a marathon, especially if you didn't do marathons prior to chemo. Now, you may be able to stay semi-active, similar to what you did before. So if marathons were normal, I wouldn't expect to run marathons during chemotherapy. I never did them before then. But if you're used to a certain activity, you may be able to try to do that. I would take things one day at a time, and that's a whole nother tip right there. I also mentioned trying not to eat much junk food, because junk food can cause inflammation. Inflammation causes pain. Neuropathy is a form of pain, and sometimes not just pain, but numbness and tingling in your extremities, like your hands, your fingers, your feet, and your toes. This is a particular side effect that sometimes or even often happens if you're taking taxol. And one thing that many people suggest doing with that is to make sure that you ice your hands and feet while you are taking taxol. Another thing you should tell your care team is if you think you're experiencing neuropathy, because they may be able to prescribe something for you. It's very important to try to keep this under control, because the side effects, that neuropathy may be something that's long lasting, or you may have to endure it forever after neuropathy sets in. So it's very good to try to stay on top of that. Insomnia is something that it can be an obvious side effect from what you're going through. And part of that is just the sheer psychological trauma going on with being diagnosed with breast cancer and wondering about the unknowns. And I credit my faith for helping me get through that. It's also good to ask if you can be referred to a therapist. Ask your care team for a referral for a therapist, or ask a social worker that's with your care team for a referral for a therapist. Don't be ashamed to ask for that kind of help. If you want a faith-based therapist, you might seek your church, or if you don't go to church, stop by a church and ask to talk to someone, or ask if they can give you a connection to a good faith-based therapist. Joining support groups might be a good idea. It depends on the support group that you join, because some support groups can be worse than not joining one at all, because they can be skewed with a lot of people that are newly diagnosed. Then again, there are other support groups that are faith-based that have people that stick around because they feel like that's part of the purpose of their breast cancer journey, is to stick around and help people that are newly diagnosed to navigate their breast cancer journey, to help them handle their psychological and spiritual struggles they're going through on this journey when you're first diagnosed, through treatment, and even in life after breast cancer. It helps to have a support group, because the people in that support group, most of them understand what you're going through. We may not 100% understand your unique situation, but chances are somebody has dealt with what you are enduring, or is dealing with what you are enduring. So you are not by yourself. It's a place to go to talk to other people that understand what you're going through. You may not want to tell other people other than your care team, because you feel like you might burden the people around you. A support group is a place where you're not going to burden the people around you, and they understand, and it gives them a purpose, and it gives you a purpose. So that might be something you consider. I founded an admin, a support group. It's faith-based, so I also initiate prayer, and other people do as well. And I encourage scriptures, and I do lives in there that cover my personal Bible studies, where I include some encouragement. So if that's something you believe that you could use in this breast cancer journey, especially in your active treatment, I encourage you to go to the link below for that breast cancer support group and join it. Now, you will have to tell me a little bit about where you're at in your breast cancer journey, and that is to help maintain the integrity of the group, because I don't want just anyone joining. I want to make sure that you are a breast cancer survivor. I also only allow women in that breast cancer support group, because I don't know how to serve men with breast cancer in that support group. As I said earlier, always run all of your medications and supplements through your care team, your oncology team. But another thing that I would suggest is asking them if you can take melatonin. My general oncologist said that I could. Another thing that you might want to run by your care team is if you can have turmeric in your food. I wouldn't suggest taking it as a supplement, but you can ask your care team because they may say it's okay. But turmeric helps with managing inflammation, which can also help with your sleep because inflammation causes pain and it causes indigestion, a lot of issues that can keep you up at night. So ask if you can have turmeric in your diet. I cook with it all the time. I learned about turmeric when I was doing active treatment, and I've picked up using it ever since. Just make sure when you're cooking with it that you always have black pepper with it as well, because if you do not take black pepper with it, if you do not put black pepper, season your food with black pepper as well, then you can't absorb the benefits of the turmeric. But it can help a lot with inflammation. But do run it by your care team. I want to make sure I mention this as I'm wrapping up this video, but I want to remind you not to be too hard on yourself. So many of us that have gone through active breast cancer treatment of any type, we get hard on ourselves when we're exhausted. I want you to remember you're in the fight of your life, and that may not look like you are doing martial arts or look like Hollywood where you're fighting for your life. But you literally are fighting for your life. So of course it's going to be exhausting, and just keep that in mind. Take this one day at a time. It's okay to take naps when you're in the fight of your life. Now, I would recommend that there's short naps throughout the day, because if you take one that's too long, it might make it hard for you to sleep at night when you really should be sleeping, because that's the time your body usually naturally produces its own melatonin, which is something that helps you sleep. It is a sleep hormone. So it's good to try to sleep at night, but when you're in the fight of your life, you're going to want to take naps. The key is to listen to your body and allow yourself to take short naps, no more than maybe 15 minutes. But again, listen to your body. Do what your body is asking you to do. This is not like fighting off the common cold or a stomach virus. The chemo is literally there to kill off your cancer cells, especially if it's not targeted therapy. Of course, it's going to exhaust you. So truly, I can't stress it enough. Listen to your body and allow yourself to rest. Breathe in, breathe out, breathe. I found myself doing a lot of that throughout my breast cancer journey, and I do a lot of it in my life after breast cancer. One thing that I want to remind you, and then I'll end this video, is to take this breast cancer journey one day at a time. One day at a time. You're not expected to have this all figured out. You have a care team with you that will help you along the way. And if you don't, I suggest that you get another care team, because that is their job, to help you along the way. If you have any side effects, they can help you navigate that. In the breast cancer support groups, we can suggest some things, but we do not replace your care team. Some days, I'm not going to lie, you will be taking it one moment at a time, and even one breath at a time. And there's nothing wrong with that. We didn't ask for this. Nobody asks for this. I know it can be annoying when you're told that you're strong. We just do what we have to do, right? If you're struggling with this, join my support group. I'm here to help you, and so are so many people in my support group.
Hot flashes can be crazy. My husband could literally see one coming on. That's how bad they were. You literally have to breathe through those sometimes. Sometimes, like I said, several times, for other things that you manage with your side effects, try not to eat junk food. it causes inflammation. It can also bring on these hot flashes. I still deal with hot flashes and night sweats in my life after breast cancer because of the hormone blockers that I take. And I've noticed that the better I take care of myself, the less I have these hot flashes. You can also tell your doctor, your care team, not just a doctor, but your oncology team, about these hot flashes you're experiencing, because they may be able to give you a medication for that. Effexor sometimes works. They will most likely prescribe something to help with the hot flashes. I'm going to leave some links in the description for things that will help at nighttime when you have hot flashes, when you're trying to sleep, because that can be especially annoying. It does help to have a ceiling fan on or have a box fan or something that blows on you. Cooling bedding. I have a cooling mattress pad. I have cooling sheets. I have cooling pillows. Those all can help a little bit. I can't guarantee how much they're going to help you because every patient is different, but I will leave some links in the description to cooling bedding and other things that might help you.
You're never told that life could ever get this way. This bill's a joke, you're broke, your love life steal away. This journey feels like you're in second gear, where it hasn't been your day, your week, your month, or even your